Hello and welcome. Thanks so much for tuning in. We are live here on Facebook with another edition of our COVID-19 updates here in Berrien County. My name is Jillian Conrad. I'm with the Berrien County Health Department, and I am joined here today with Nicki Britten, our health officer for the Berrien County Health Department, as well as Dr. Loren Hamel with Spectrum Health Lakeland. Thank you both so much for being here, and thanks for tuning in today or catching this as a replay on Facebook later today. So we've got a lot of things to discuss as per the usual, but we wanted to jump right in and hear some of the latest that we've been listening to in the headlines with COVID-19 vaccine news, and that has to do with the Johnson & Johnson vaccine. So just to kick us off, Nicki, can you give us an overview of what's been swirling around in the headlines? What were the announcements made just yesterday by the FDA and the CDC?
Yeah, early yesterday morning, the CDC and the FDA released a joint statement indicating that there needed to be a pause in the administration of Johnson & Johnson vaccinations to be able to review what we're referring to as kind of a signal event. There were 6 cases of a rare and severe type of blood clotting disorder in 6 individuals. So there were 6 cases of this. All of those individuals had received the Johnson & Johnson vaccine about 6 to 14 days prior. And all the cases occurred in women between the ages of 18 and 48. So given that there was something that was a very rare event, but fairly serious, our federal partners, the CDC and the FDA, are recommending that pause so that there can be a little bit of time to review some of that data to determine, is this just the tip of the iceberg? Is there a little bit more out there? Is this really only 6 cases of something out of 6.8 million doses of Johnson & Johnson vaccine already administered in the United States? And what further steps, if any, may need to be taken? We expect that this pause will likely be relatively short in duration. The meeting is scheduled to start, I think, in about an hour, where the committee is going to be discussing the data. So we, like the rest of you all, are awaiting to hear what those experts say upon that deeper review. This pause also just gives an opportunity for healthcare providers to have a better understanding of, even though it could be, we don't know if it actually is a side effect of the vaccine. If it is, it would be something for providers to know that they could be on the lookout for, because there's a course of treatment that would be needed, and being able to assess a vaccine history would be really important. So right now it's just a pause, very, very rare. Again, 6 cases out of 6.8 million doses. So less than a 1 in a million occurrence with the data we have right now.
So what is that looking like here locally? What is the impact on this pause here in Berrien County?
Yes, so we have been administering Johnson & Johnson vaccination. The health department has had some, the Spectrum Health Lakeland has had it, some other partners have had that vaccine. We haven't had a ton of it, as it was just starting to be allocated to communities in March, but we have suspended the use. We have it all set aside. We had our next Johnson & Johnson clinic was scheduled for tomorrow, April 15th. So anybody that had registered for that clinic has been notified or is in the process of being notified that there will be a different vaccine product. It will be Moderna that we will be using at that clinic. We know some people had specifically sought out the Johnson & Johnson vaccine, so there was an opportunity to say no thank you if that was not. Again, we are encouraging everybody to take the vaccine that is available to you, because getting vaccinated is very important, but we're working through all of that communication. And as we learn more from our federal partners after this review that's happening this afternoon, we'll have a better understanding of what next week will look like.
Wonderful. So we know that with this announcement, there might be some folks that are feeling a little bit nervous if they did just get the J&J vaccine recently. Dr. Hamel, what do our community members need to know if they just got that vaccine?
Well, a couple of things I think are really important. One, Nicki clearly stated, this is 1 in a million. And we don't know how that's all going to turn out, but whether it's associated or not, I suspect it will be found to be associated with the vaccine. But it's 1 in a million. You know, if I were listening in, here's the way I'd express that concern. Now, why are we just figuring out this now? Why, is it because we rushed to the vaccine? You know, why did we know that when we started? Well, in any treatment of any kind, when you have it in use over a period of time, you discover potentially rare complications. You know, the initial trials of this were on tens of thousands of people. And even after hundreds of thousands of people got this vaccine, we had no indication that that could be a complication. It's only until you give tens of millions of doses that you can find out, well, maybe there is a rare complication. Is there somebody that is uniquely vulnerable to a complication? And that's what's showing up now. And so the first thing you need to know, we have given 78,000 doses in Berrien County. The chance that we're going to have a 1 in a million complication in Berrien County is, you know, 1 million divided by 78,000. You know, it's going to be about 1 in 12 that we have anybody with any chance of that kind of reaction. So first, don't worry. Second is, you know, blood clots tend to give symptoms. You know, if you get a headache or swelling in an extremity, if you are not feeling well in any way, you know, serious kind of a symptom a week or so after vaccine, of course, we want to know no matter what, but the chance that you're going to have a blood clot is extremely low. And of course, with any medical treatment, we still are always talking benefit and risk. And the benefit is still clearly on the side of taking the vaccine. The other thing I would just say is the Moderna vaccine, or the J&J vaccine, is different than the Moderna. It's manufactured in a different way. It's manufactured in the same way the AstraZeneca was. And we have concern about both of those vaccines with the possibility of rare blood clots. And before you just blame the vaccine, we know that the disease produces a risk of blood clots. And the disease produces a risk of blood clots in a person with low platelets. And so we know there's some part of this virus that is in some rare individuals is giving them an increased risk for both bleeding and blood clots in the hospital when they're really sick with the disease. I've seen this in numerous patients. And so part of that virus codes undoubtedly for that complication in rare individuals. And when you make a vaccine, so your body recognizes that virus, it's not impossible that you make it with a part of that virus that might code for that rare complication, extremely rare complication. But your risk for that complication with the disease is still markedly higher. And we know that from clinical experience. So it's not a huge surprise. It's a significant setback. It's going to create significant worries. But even if that vaccine is found to have a 1 in a million complication rate, that is not that different than many antibiotics we prescribe, many medications for blood pressure. If you go in and decide you want to be on birth control pills as a young woman, and I think that's relevant to this discussion because most of these individuals were young women, we know the birth control pill in some rare individuals increase the risk for blood clots. Now, most people would say benefit risk, having sex, making babies. You know, what do I want to do to help control that? Most people would say birth control pills is a pretty good way to do that. But there are still some small risks. So a complicated discussion, but I think you can be pretty comfortable that your individual risk is extremely low. Your chance of getting struck by lightning in your lifetime is 1 in 140,000. And we don't worry every day about getting hit by lightning.
Certainly. Well, that definitely helps put some minds at ease, I'm sure. And the good news is we are still vaccinating with the 2 other vaccination products we have, which are safe and effective here locally. So Nicki, can you just remind everybody who's watching who's eligible to get a vaccine now and how can they go about getting an appointment?
Yeah, anybody who's 16 years or older is eligible for vaccination now. So we're encouraging anybody 16 plus to schedule a vaccine appointment. There are many providers out there, not just the health department in Lakeland. We've got lots of pharmacies that have vaccine. It is important to note that if you're 16 or 17, only the Pfizer vaccine is approved for use in those younger ages. So if you're 18 plus, any of the 3, well, Pfizer and Moderna are definitely available. Johnson & Johnson's on pause right now, but that's rated for 18 plus. But Pfizer is the only one for 16 and 17-year-olds. So both Lakeland and the health department, we have open scheduling tools on our website. So anybody can log on to our websites, snag an appointment. If internet access is not your thing, or you prefer to have a phone call, you can call the health department at 1-800-815 888-269-5485 or call Lakeland at 269-927-5100.
Wonderful. And Dr. Hamel mentioned a minute ago that there have been more than 78,000, closing in on 80,000 doses of the COVID-19 vaccine administered so far here in Berrien County to date. Nicki, how else is the vaccine rollout going? What other statistics can you share with us?
Yeah, so I mean, we have over 50,000 people, 16 and plus, in Berrien County who have already received at least one dose of vaccine. So that is a significant proportion of our 124,000 people that are 16 plus. So we're at over 40% initiation. We're about 30% completion of people who've either had one dose or two doses. They've completed the series. So we're getting a lot of coverage. We have crested and met the goal of 70% coverage in our adult 65 plus. So we're very happy about that. And, you know, as I think Dr. Hamel will tell us a little bit more about, we're seeing a shift in who's being hospitalized and who's being our cases are being a little bit younger. I really think that's because we have prevented, we've had this invisible result. We now just don't have those cases happening in our older adults. So we're very glad about that coverage. So we continue as a county, as a health department, we're getting thousands of doses out each week. We want to make sure that you get your shot. So please do what it takes to get yourself an appointment at your preferred provider.
Wonderful. And it sounds like there's even still appointments available yet this week at both Lakeland down in Niles, as well as the health department here in Benton Harbor. So if you haven't gotten a dose yet and you're interested in getting that vaccine, your chance could be even this week. Well, Nicki, we know that while we are doing really well with the vaccine rollout and that continues along, we have seen a bit of increasing cases, not just here in Berrien County, but across the state of Michigan. Michigan as a state has been in the headlines as the nation's hotspot. Can you tell us more about what we're seeing as far as trends and cases go here in Berrien County?
Yeah, and you know, here we are, you know, with great vaccination coverage, not full, not to the point where our work is done, but making great progress. And so the discussion about just trends just has to, in some ways, become a little bit more nuanced as to what's going on. In Berrien County, we are continuing to see a little bit of an increase. Last week, we had been somewhat flat. That might have been an artifact of spring break, just fewer people in town and getting tested and doing that. And so we are starting to see a little bit more growth in our cases. So we're between 55, 58 new cases per day on average over the last 7 days. However, what I think is encouraging is our rates right now are double what we were a month ago. So it has taken us about a month to double our number of cases. Back in October and November, when we were experiencing that really significant surge, we were doubling our cases every 10 days. So while we don't want our cases to double, we don't want to continue seeing that exponential growth. The fact that that's happening much more slowly now is a good sign. When we have that slower growth, it does help us keep our hospital admissions and our healthcare system at a capacity where it's manageable. So that slower growth is a good thing. Now Berrien County's situation is not the experience across the state. We have many regions in our state that are experiencing much more rapid growth, that have as many as 4 times as many cases as case rates per population in those parts of the state. This could mean that maybe it's coming our way and just hasn't gotten here just yet. Or maybe it's something that because we have a little bit less population density, we've been able to move through and have a larger proportion of our population vaccinated. Maybe we will continue to have some of that slow growth. It's hard to know. The other factor that's just a little bit different right now is the variants. We know that there are more variant strains. The B117 variant, or also known as the UK variant, is definitely the predominant strain in the state of Michigan right now. And we know it's a little bit more infectious. It's more easily spread between people. So with that in mind, that's why we're seeing some of these increases. Again, we're really lucky that right now, not today, are we kind of at that breaking point. But this is a warning for all of us to just make sure that we're being diligent in the protective measures we all know that we need to do, getting your vaccination, still avoiding, close contact with other people, reducing your exposure, your risk, good hand hygiene, staying home when you're ill. All of these things still remain important things that we need to keep doing while we're in this messy middle period of vaccination and not and all of that.
So you mentioned just different experiences in various areas around the state. Just last week, Governor Whitmer did make a recommendation for schools to voluntarily choose to go remote and discontinue high school sports at this time. How is that being handled locally? What's our recommendation here in Berrien County for our schools?
Yeah, so late last week, following that recommendation, we did reconvene. We have very regular meetings with school leadership here in Berrien County. We go through data with the school leaders 1 to 2 times a week, just looking at trends both in the broader community as well as what's going on in the schools. We are notified and work with the schools every time there are cases in the schools. We're very aware of what is happening, but we also understand some of the nuance of the cases of, was this likely acquired in school, or were there other contacts with students outside of school, perhaps in social settings, that could have been driving some of those cases? So we have spent the entire school year being really involved in what has been going on. So with all of these things taken together, the health department did notify the schools that if they wish to continue with in-person learning, that would be acceptable given the amount of transmission and what we're seeing in our community. Plus, there are a lot of benefits to in-person learning. So as we're making this risk-benefit calculation, it's always about COVID risk, but then also the benefits and potential harms of other things. So weighing that out with school leaders, it was decided that in-person learning can occur. There were some schools that had plans in place for how they were going to proceed after spring break. From an operational standpoint, a lot of them stuck with that, but there was not that last minute decision. We really are not seeing school settings as being the drivers of transmission amongst our youth and teens in our community. Teens and those under the age of 18 are making up a larger proportion of the cases than we have seen previously, but a lot of that is because we don't have as many older adults that are cases. So just the slice of the pie that they take up is getting a little bit bigger. There are additional cases in real numbers as well, but we are not seeing increases in hospitalizations and severe outcomes of those age groups either. So at this point in time, the benefits of in-person learning seem to outweigh what's happening. And we have our vulnerable older adults well covered with vaccination. So we're a little bit less concerned about transmission amongst youth potentially spilling over into that population. Lastly, we have also found schools do tend to be some of the safest places for our students to be in terms of COVID transmission risk. It is a fairly regulated environment where the schools enforce mask wearing and social distancing, and there's hand hygiene protocols in place. There's screening for, excluding ill people. That doesn't always happen when students are on a virtual learning schedule and might be congregating in informal groups to do study groups or to do online school together, or maybe they just have a little more free time where they might be driving around town together or participating in things. So having our students in a more regulated environment for several hours a day, every day, is probably better for our community.
Let's turn our attention now to the hospital. We know one of our goals is to slow transmission enough and increase vaccination enough where we are not seeing so many sick people in the hospital. But Dr. Hamel, can you speak more about what's going on there at Lakeland and any news that you have to share about updates and operations at Lakeland?
Oh, certainly. Our inpatient trend has very closely, as you would expect, mirrored the outpatient COVID cases or the community COVID cases that Nicki just described. We've seen them increase. We've seen them increase at a slower rate than our previous surge and with a bit of a younger population. We're running in the mid-40s in terms of inpatient census. The proportion that are in the intensive care unit is a little lower, and it appears that the mortality rate will be a little lower, but it's still significant. You know, the mortality rate across the country and the state of Michigan at Lakeland is running, near 2%, sometimes a little less, in some places a little more, but about 2%. And we think that's going to be probably a little lower during this surge. It's too early to tell because we're early in the fourth surge experience. But we are delighted, it appears, that it's not growing quite as fast and that folks seem to be doing a little better. It still is a very significant disease. And we're seeing in younger people in the intensive care unit, younger people on ventilators this round than we did in earlier surges, including 20 and 30-year-olds that are just very sick. Some of them are as sick as the seniors were in November. Because of the increase in inpatient volume, we need to manage visitation a little more strictly. We were able to liberalize that a little bit as our COVID census dropped. We've had to go back to one adult visitor between 11 in the morning and 7 p.m. during the day for that patient's stay. 2 visitors are allowed in labor and delivery and with pediatric patients, and 2 visitors for individuals near the end of their life. For those that are admitted with COVID, we still are needing to insist on virtual visits, and we'll help in any way we can to make sure those virtual visits occur. For those that are accessing care on the outpatient side, it is not uncommon to have somebody either with physical or cognitive impairments that need a little extra help. And so we're not only allowing, but encouraging an adult companion to help make that person's health care accessible. So that's some of the things that are changing around Lakeland.
All right. So Nicki had mentioned a minute ago that we had a lot of folks that were on spring break last week. Many of those people might have chosen to travel outside of Michigan to other states, other places during that spring break. So knowing that they're getting back now, maybe they're starting to feel symptoms, maybe they learned that they were exposed. What are our recommendations, Nicki, for those folks that are coming back post spring break travel? What should they know at this point?
So if you are experiencing any COVID-like symptoms, go ahead and get a test. It's good to know what's going on. Or if you've had a known exposure, if you found out you were exposed to somebody, we also recommend that you get tested. There are many places throughout Berrien County that will do testing. There's a lot more places that are doing the rapid antigen testing, which is just a nasal swab. It's not the NP swab, so it's not as uncomfortable and you get your results more quickly. So if that has been your deterrent, don't let that deter you. There are places to get the rapid tests, and you can find those on the health department's website. And a known exposure is somebody who had close contact with a confirmed case during their infectious period for a total of 15 minutes or more. So it can take several days for the virus to incubate in your body. So we're recommending that if you were exposed, to wait until 5 days after your exposure, so that your body has had time to actually have the viral replication so it can be detected in the test. If you get tested too soon, it can show a false negative. I know that there are some ways through Spectrum Health Lakeland. Do you want to talk about that, Dr. Hamel, to get tested?
I'm sorry, I missed your last sentence there.
Testing through Spectrum Health Lakeland?
Oh, certainly. You can get tested by calling your physician. You can get tested by going to any of our urgent care areas. And, we would encourage you to try to meet the criteria that Nicki just described. We don't want to do tests and just waste them on you or give you false negatives. So make sure that you're timing it appropriately. But we're happy to help any way we can with testing. The Berrien County Health Department also, of course, has testing sites on their website. So if one of our sources is not convenient, together we'll make sure that you get a test.
Yeah. And for people who were exposed, in addition to seeking a test, you do need to quarantine as well. Mm-hmm. And quarantine for 10 days if you have no symptoms. And that 10 days starts from the time you were exposed to that individual. People who have tested positive, regardless of whether or not you have symptoms, do need to isolate for 10 days.
So Nicki, you have mentioned a couple of times now the messy middle period that we're in, with some folks being vaccinated fully, some folks still contracting the virus. But we do know that the CDC has revised some of their guidelines regarding what fully vaccinated individuals can do. Can you speak to some of those benefits of full vaccination that folks could look forward to?
Yeah, and just to define what fully vaccinated means, that is 2 weeks following the last shot in the series. So for people that received a Johnson & Johnson, which is only a 1-shot series, it's 2 weeks following that. If it's a Pfizer or Moderna, it's 2 weeks following the second shot. So individuals that are fully vaccinated per CDC guidance are able to gather indoors with other fully vaccinated people without wearing a mask. Gathering indoors with unvaccinated people from one other household without masks, unless there are people that you have severe risk of or increased risk for severe illness. So if there are elderly folks around or others that might be at increased risk, might want to really think about that carefully. Another benefit of being fully vaccinated is if you're exposed to somebody with COVID-19, you do not need to quarantine. And the CDC has said that you can safely resume domestic travel without being tested or self-quarantined before or after travel if you're fully vaccinated. So being fully vaccinated is not a ticket out of everything just yet. We do still have epidemic orders in place indicating, mask wearing in public places, at work, all of those sorts of things. Still need to happen, but there's definitely a little bit more freedom for some small gatherings amongst fully vaccinated people.
That's definitely good news and something to look forward to, and another incentive for those that might be on the fence about getting vaccinated at this point. As we wrap up, Dr. Hamel, what other thoughts do you have to impart to the group listening today?
Yeah, thanks so much. Well, a couple of things. One is, even as we're kind of balancing some increase in cases, significant in Michigan, some new variants, some relaxation related to mask wearing in small groups related to vaccination. As we're weighing all that together, I just encourage you, be a good neighbor. Make sure that you're doing everything you can to protect those around you, and ask those around, are you comfortable? If you're visiting with somebody, are you comfortable without masks? Here are the rules. Make sure you're reminding people of those rules. But be a good neighbor. Number two, make sure you keep tuning in. As you know, this is changing frequently, often. And so make sure you're staying well informed. Number three, I will say this until everybody in Berrien County is vaccinated. And I know there's some of you that don't want a vaccination. I've talked to you, and I know your concerns. Vaccination is still markedly safer than COVID. This is one wicked disease. It is mutating around the world. It is becoming more contagious. There is evidence it's becoming more lethal. If we give this virus enough time to mutate in enough bodies, we're going to find that those mutations are resistant to our vaccines, and we're going to be starting a new round with new vaccines. That's going to come if we don't have enough herd immunity soon. I think there's a lot of science behind that. I believe that you are going to have an antibody in your blood one way or the other. You're either going to get sick or you're going to get vaccinated. Ultimately, almost all of us will get exposed and to either the antibodies in the vaccine, from the vaccine, or the antibodies from the disease. And I would just continue to remind you, the vaccine is absolutely the safest way to put that antibody in your blood and to help protect you and those you love.
Nicki, any parting thoughts from you?
Yeah, I would just continue to remind people, the why we're doing this, because we're at a point where we're really weary. The idea that we're going to keep wearing masks for a bit longer, or that we're maybe going to be in smaller groups for a bit longer, or that, we're racing against a clock potentially for something. I know that can feel really tiresome. I know there's a lot of anxiety out there, but in these moments, it's important we go back to our why. And the why is because life is precious and we want to save the lives of our friends and neighbors. We don't know the untold lives that have been saved. It could have been my parents, it could have been your family members, it could have been you, based on the actions that we've all taken already thus far. And so I just encourage us to think about that and remember, yes, it's a little bit cumbersome. In the big scheme, this is a short period of time. Don't want to minimize any of the difficulty that this last year has brought on all of us, but if we stay focused on the why, some of that burden lessens and we can become more focused on how do we carry this burden together? How do we look at the finish line together and take the decisive action towards getting us there together?
Well, encouraging words from both of you, and thank you so much for joining us today and providing these updates for our community members. Thank you for tuning in today, whether you're watching live or catching the replay. You can find lots more information about everything we talked about today at both the Berrien County Health Department and Spectrum Health Lakeland's websites. Thanks so much again for being here.
Thank you.